Hello everyone. Today, our group would like to discuss women's health issues, a topic not nearly discussed enough. Women's health issues are very important, yet unfortunately, our society does not always give them the emphasis they deserve. Our aim is to raise awareness to this issue. Our group has decided to discuss polycystic ovary syndrome.
We chose this topic because PCOS, the Asian culture heavily scandalizes women's health issues, and this is a barrier we are trying to break. Overall, the prevalence rate for PCOS in Egyptian women is 22.6%. It has seen a near consistent growth rate of approximately 1% annually.
Moving on, now we're interviewing one of the best consultants on women's health and labor issues. Dr. Tariq Abdulzahir Al-Oud is one of the best practitioners on women's health and mother/baby health care. Our colleague Shahd is interviewing him today in his popular clinic, Alexandria, Al-Oud treatment clinic for women's health and critical labor conditions.
Hi, Dr. Tariq. I wanted to ask you please about PCOS. Could you please define it for us?
It's a disease which affects a lot of women during their reproductive life. It's characterized by the presence of cysts in the ovary. This is ovary, instead of being ovulation, it is filled with cysts. Most important three symptoms are menstrual irregularity, very morbid obesity, third thing is that you have androgen excess. So this disease starts from adolescence.
Okay, and what are the prevention techniques?
This disease has three important sequelae. Metabolic as a form of insulin resistance, cosmetic, she has bad side, reproduction, she's infertile and she may have bleeding. The most important prevention factor is to fight obesity. Number one, diet. Number two, exercise. The most important weapon to attack this disease.
And how many women came to you in the clinic that have no idea they have PCOS before, or the fact that they had no idea about PCOS in general?
It's a very common disease, very progressive. A lot of patients, especially adolescent patients, mothers let them to get obese, don't ask them to do exercise, don't do a proper diet. So this is increasing.
Do you think it's a topic that's talked about enough?
No, increase the people awareness about this disease, especially as I told you, the adolescent women, adolescent girls.
Okay, thank you so much, Dr. Tariq. It was a pleasure to meet you.
Thank you very much.
As you've seen, PCOS is a very serious issue that affects women's health. Symptoms may vary from one to another, but in the end, we all fear infertility. I mean, who doesn't want to be a mother one day? We finally found a woman who experienced PCOS herself, and let us share with you her story. How and when did you find out you had PCOS?
I went to a gynecologist because I had continuous breast pain at 16 years old, and he diagnosed me with PCOS.
Did you know what PCOS was before you got diagnosed with it?
I did not know what PCOS was before getting diagnosed.
How has it affected your life since?
I see people saying it may cause infertility, so that's a fear I have.
Are there any lifestyle changes you have made since you got diagnosed?
Not really, but I did take a dietary supplement regularly for 4 months.
What are common symptoms of patients with PCOS?
The symptoms I know include tiredness and irregular periods and high testosterone levels.
What are recommendations that your doctor has given you?
He advised me to gain weight.
Do you feel that it's not commonly talked about? And if yes, why?
Yes, maybe because few people have it, and it's just considered an imbalance that's fixable in mild cases.
To conclude this video, we would like you to know that PCOS is okay. Even famous people like Kim Kardashian or Selena Gomez face it. And we want you to really look out for the risk factors, as you may never know, you could develop